Welcome everyone, and thank you for joining us today. Today's topic is really appropriate with the 4th of July coming up. It's noise phobia. Our presenter today is Dr. Jeff Nichol. Dr. Nichol did his undergraduate studies and graduated from veterinary school at Michigan State University. He has been a veterinary hospital owner and practiced general and behavioral medicine throughout his career. In 2015, Dr. Nichol completed his residency in behavior medicine through the American College of Veterinary Behaviorists. His current practice, located in Albuquerque and Santa Fe, New Mexico, is now limited to the diagnosis and treatment of behavior disorders of pets. Medical comorbidities are a common feature in his caseload. We welcome Dr. Nichol.
Well, good morning. And I'm glad that everybody is here because you already know that your pet has a problem with noise phobia or noise sensitivity, and there's a little bit of a difference. What I want to do today is talk about just which pets are affected by fear of fireworks and thunderstorms, and I'll explain what this problem looks like so you can recognize the fine points. You'll need that to be able to manage it at home. And related behavior problems are important too because they can improve right along with your dog or cat's noise phobia. And then I'll explain how to help because that's really why you're here, and we'll do it all in the next 30 minutes. So let's get started on this thing. What I want to do is explain that this is a serious problem. You are right to be concerned. The good news is that noise phobias don't occur every single day, at least we hope not. But when they happen, these dogs are already sensitized. And if you look here at this definition of noise, of phobia, it's an extreme problem. It's a persistent and excessive fear, and it's out of proportion to the threat, meaning that a dog who has fear of fireworks, it's never been hit by a bottle rocket or an M80. It's not a logical fear. But this dog can be petrified, and it is something that we know from lots of research that this is something that happens in a lot of dogs. About half of them have some degree of it, and it isn't an all or nothing thing. It isn't like, oh, your dog is totally, copacetic with noises, or it's just a freak out. There are various degrees in here. And that's important, but this is just really a significant welfare issue for pets because, well, they're miserable, and so are we. People want to do something that works, and they don't know what to do. People have tried lots of ways of helping the pet, and well, if all that stuff had worked, you wouldn't be here. This dog is Coda. He actually belonged to a friend of mine, and so he shot this video during a thunderstorm, actually. And you can see this dog is trembling. He's right up next to his person. And this would go on for long periods with this dog. He needs help, and his people need help. This is so distressing for everybody. So let's look at the totality of this kind of stuff, because when we help a pet, I don't care whether the problem is behavioral or whether it's internal disease like chronic vomiting or diarrhea or poor appetite or excessive drinking of water. A doctor's job, and hence the pet parent's job too, is to say, well, number one, what is the underlying cause of this? But also, what else might be involved? Because if we don't parse apart all of the issues and do our best to manage everything that might be influencing your dog's well-being, we're just not going to get a very good result. So let's be thorough in our management and look at, well, what else is going on? You can see from this diagram, the separation anxiety is a very big part of many of these issues. We're not going to just treat symptoms here. We're going to try to understand the cause and really help that pet. And not just each time, but every time. So we talk about noise sensitivity and noise phobia, the dogs who just freak out. We need to understand that there may be other things going on too. It turns out that as many as 40% of dogs who have separation anxiety also have noise phobias. Might be fireworks, might be thunderstorms, gunshots. And in fact, some dogs are so noise reactive, and noise sensitivity, a little bit of a different. Anyway, some of them are so reactive that even minor household noises, like the creaks and pops in a house as it settles, or the microwave beeping. There are some dogs who have such advanced generalized anxiety that separation anxiety and noise reactivity are just a couple of the problems. So one of the most valuable things you could do in helping your pet, not just this 4th of July, but in a broad long-term sense, is understanding what else is going on. And these slides are going to be available to you, and I want you to, when you're finished with this webinar in the next 20 minutes or so, I would like you to just think through and get with your family, whoever else lives with you and your pets, and say, what else is going on? Does this dog react to strangers? I mean, more than just a little bark when he hears somebody come to the door, or is your dog completely wigged out when people walk in the door? People think, oh, that is an aggressive dog. It might be a very fearful dog, fear being an in-the-moment problem, but it's the smoldering anxiety that makes those fears just spike when something comes along that really rattles the pet. And some of these behaviors are just not normal. And so very often, if people are for example, away from home at work, which a lot of people aren't right now, they don't know that their pet's freaked out when they're home alone. They don't necessarily understand some of this other stuff. But dogs who are wigged out in the car, a lot of these things are related. And so let's be thorough. And your veterinarian, of course, it's that doctor's job to, be thorough and recognize all of the factors and ask the right questions. But we rely very heavily on pet parents to speak for their dog or cat, because the disadvantage of being a veterinarian is our patients don't speak a human language. They don't show up on their own. So we rely very heavily on what our pet parents have to tell us. So just do your best to be observant and recognize that stuff. So one of the most important things that we do when we treat any of these noise-related problems, including fireworks, is avoidance. The idea that a pet is supposed to, be tough and face his fears, the John Wayne of the canine world. Let's be real. All of us humans have fears and anxieties and worries. Truth is that anxiety is actually a normal condition to a degree. Back in the day when our species lived in the wild, we were looking over our shoulder for predators or other groups of people who would steal our food and other resources. Well, that's the way dogs function in the wild also. They cannot survive if they're not looking over their shoulder. So some of these anxieties is what keeps us surviving. Well, it gets out of control. Well, we've got a noise phobia problem. Holy smoke, they're just wigged out to the max. And we have a very clear understanding physiologically of the hormone changes, the adrenaline rush, and what that does to the brain and to other organ systems in the body. And let me digress for a minute and and relate the noise phobia issues to some of the other anxieties that we just talked about. If your dog is reacting to many different things, maybe to a lesser degree than the noise, but still reacting, there is physical damage that's going on. So let's do our best to diminish those problems, because when the dog or cat is less freaked out, then they can learn healthier alternative behaviors. But they can't learn anything if their brain is overwhelmed with excitatory neurotransmitters like adrenaline. The research that we have is very heavily focused on not just helping these problems, but also what's going on in this organ right here. The brain is a very physical organ. It is considered the most complex in the body. And so mapping the genetic components to this is a big part of what we do, but understanding the neurochemistry is part of the way that we help with these. But let's really help this thing settle down by avoidance. So mutt muffs. You see this little guy in the upper right corner? His name is Caden. He's a Sheltie, and he had a horrible noise phobia problem that we got under control very successfully by integrating a whole bunch of different treatments and management. And one of the most valuable was these mud muffs. And if you look carefully, it looks like he's wearing ear muffs. Maybe he's a pilot, or he's, you know, well, this is a very well-made product, and it does an excellent job of diminishing the amount of noise that comes through the dog's ears. Light flashes from fireworks would really ramp these up, so close the blinds. And there's something called a thunder cap. You'll see that in that picture of the dog down below. You can get these things on the internet. Amazon, other places have them. You can Google it, and you can put a rush on. You can get these things by July 4th if you get busy right away. Most dogs accept both the mutt muffs and the thunder cap very easily, and they feel much better while they're wearing this stuff. Controlling the amount of noise that is coming into your house. Loud, noisy fans, we've got these tower fans now that are very quiet, but some of the old-fashioned fans that, were in those boxes, a box-shaped thing, and it would blow air, a great big thing, 3 foot square or so. They were pretty noisy. Those things can be helpful. There's some music called Through a Dog's Ear that has been scientifically developed to promote alpha waves, the calming waves in the brain, and those are in synchrony with the natural rhythm of the brain activity in the species in particular. They have Through a Cat's Ear as well for cats. And it's actually very pleasant music. It sounds like classical music, and it's a great thing to play around your house. But you can play that somewhat loud. You can do some trial and error to see which of these things works. How loud should the fan be? How loud should the Through a Dog's Ear or Through a Cat's Ear? Some dogs and cats do well with white noise. You can download this from the internet. Again, it's a trial and error thing. And some people play classical music. Really, the soft, gentle stuff works better typically. Many people say, well, let's put the dog in the crate so it can't run all over the darn house, because some of these dogs are just frantic. Do not trap these dogs or cats in a place where they cannot escape. They can absolutely freak out. So if your dog or cat enjoys a snug little enclosure, that's great. Wire crates are very popular now. It doesn't give the dog a den-like feel unless it has covered on the sides and top and back. The door should remain open. You can cover it with a sheet or a towel, and you can cover the opening, but you need to leave a gap of a few inches at the bottom. Again, trial and error, but you want it to be snug and cozy. If you use a heavy blanket in the hot weather, it might get a little bit toasty in there, but don't let any pet feel trapped. That is really essential to the whole thing. So, what can you do? You're the person on the scene. It's your job to manage this whole thing. Well, empathy really matters. And if you didn't care about how your pet felt, you wouldn't be here right now. But that's a little different than sympathy. Empathy is walking a mile on the other guy's moccasins. In this case, recognize your dog's feelings. And so what we want to do is be aware of the, like that little video of Coda, panting, the trembling, the pacing, agitation. If your dog behaves differently during loud noises like fireworks, well, that's a problem. So recognize those differences. If you comfort an anxious dog, believe it or not, you can actually worsen the problem, because dogs regard any response from their leader as having been earned by their behavior and by their emotional state of the moment. And so if you make a big fuss about comforting your dog, it may appear the dog's feeling better, but you actually fan the flames of the problem. So you want to be there, but you want to be a source of security, okay? So be kind. There, again, I doubt that anybody watching this would punish a dog or scold a dog or ridicule a dog for its fears. But you might have somebody nearby who does that stuff, and shouting and scolding them doesn't help your dog feel any better. So if you have someone who makes that mistake, I would encourage you to take your dog to another part of your house so that it's just the two of you. But these things are neurochemical and structural problems, and they are these are things that, yeah, we do understand. And classical conditioning from past events with repetition. We repeat these ramp ups in the brain, and the neural circuits actually get stronger. The old saying, practice makes perfect. Well, it actually speeds up and intensifies problem behaviors every bit as much as it does, like if you practice obedience skills with your dog and the dog gets better, Or if you or I practice a musical or athletic skill, we get better at it. We don't want our pets getting any better at this skill of freaking out. So again, back to avoidance, super important, okay? So, and last, if you've got a dog who runs all over the darn place, don't restrain them. You hold them still, particularly small dogs, and they can actually freak out more. And in fact, some of them get so wigged out that they might become defensive aggressive, which you think, I sometimes hear pet parents say, "It's the only time my dog's ever bitten me." Well, if whatever you're doing causes a problem, stop doing it, okay? And allow your dog to find the place that's going to work well for them, okay? So as much as these noise phobias are infrequent problems, the long-term coexisting anxieties that we've talked about, those things go on a lot of the time. And again, these behaviors can feed off each other. So let's be aware of all of this stuff. There's a wonderful device. It's relatively new on the scene, although the technology is not that new, and it has been improved and refined, but it's a targeted pulsed electromagnetic field device. Targeted meaning, you can see this picture. This thing actually, you can see that ring, that halo, that's part of the way this thing creates the field. But the device itself sits behind the dog's head. And I'll show you a picture of that in just a second. But this thing, you can order it from the Assisi website. Go to calmercanine.com. That's C-A-L-M-E-R, the letter K, the number 9.com, calmercanine.com. And you can order this thing without a prescription. They're totally safe, and they're effective in the majority of cases. Nothing that we have in treatment in medicine is 100%. The more desperate we get with these things, the more strongly we feel about getting it fixed right away, right? And this thing takes a little while to work, but I'll explain why it can be helpful with these things. Tell you a story. This is this dog named Sufi, suffered from acute anxiety from thunderstorms. Very similar problem to fireworks phobia. And these folks have a lot of thunderstorms because of where they live. And you can, I'm sure you can read as well as I can, panting, pacing, jumping in her lap, she just, then of course, like all concerned pet parents, Jill did everything she could to try to help her dog feel better. Well, then she got turned on to the Calmer Canine, and she found that it made a very big difference. And in fact, she did something very smart then. She recognized that this dog was feeling better, and then instituted what we call a response substitution. In other words, let's do something else. So she rolled the ball, and she actually was able to get this dog to eat treats and start to focus on something else. And she saw a substantial difference in this dog's well-being, which is really what this is about, isn't it? I mean, we only go around once in this life. Let's not be miserable. So here's Sufi, and this is her just on a regular day, and she's a very playful little girl, and life treats her pretty well here. You can see why her mom thought, getting through these events was so valuable. And here she is wearing her Calmer Canine, and you can see that device right behind her head. It is aimed at the back of the brain, the location of the amygdala, the fear center of the brain. And you can see how comfortable she is, and her person is handing her food. You don't have to hold the pet while it's wearing its Calmer Canine. So you can see it's pretty simple. And here are a few pictures of what the thing looks like. In the upper left, you can see a person holding it behind the dog's head while the dog's sitting on his lap. And that's perfectly fine way to do it. It has no effect on a person. But the much easier is to use this thing called a vest. You can see the iris setter in the lower corner there. It's this comfy fabric strap, and you order the size that will fit your dog. They've got a whole bunch of different sizes, and they have this Velcro patch. You can see that, and then there's another strap in the middle bottom photo that shows the other strap that goes around the dog's chest right behind the armpits, and then they link these two with a little Velcro thing. It's really quite simple, and then the Calmer Canine device Velcro's right behind the dog's head, and simple to use. But you're not going to get any great benefit from it between now and July 4th. And of course, around here, we've got fireworks every day throughout the whole July 4th weekend. But this is going to be a long-term thing that if you do this twice a day, just 15 minutes, morning and evening, And you can have your dog sitting with you while you're having coffee in the morning or while you're answering emails later in the day, whatever. The dog can walk around while wearing it, but you don't want them horsing around outside because it'll come off, and you don't want to damage the thing. So anyway, after 4 to 6 weeks, that's what we consider one treatment course. The great majority of dogs are much improved. And this will help very likely with the fireworks and storm phobia later. It is approved for separation anxiety, but we have found multiple different anxiety-related behaviors that have improved noticeably with this, not research-based, anecdotal reports, which in my experience, when my pet parents are talking to me in my clinical practice, I start paying attention, especially if the treatment is completely safe. I don't have to worry about it, okay? So response substitution, kindness. And obviously we're all kind people, or we wouldn't have pets and care about them the way we do. But just think about your feelings for your pet and what we can do to set her up to succeed. A special bed, something that she really feels secure in, a snug little enclosure like a closet. Many people find that it doesn't have to be a walk-in closet, as long as it's a closet that does not have exterior walls, and there's no, we can close the blinds and the dog gets in there under the clothing, and there's all that fabric, maybe there's carpet, and it deadens some of the sound. And then if there's a special bed where your dog is comfy, let your dog choose where she feels best, but provide the options for her. Okay, food dispensing toys and puzzles. I don't know if you can reach under here and show you one. This is a twist and treat. There are lots of different food toys and puzzles. This one is meant to have food put inside it. I like to use it with canned food. You can put dry in it. And if a dog's meal has been withheld, then they're a little bit hungrier, and they can shift their focus to extracting food and enjoying that challenge instead of wigging out about the sounds, which of course you've done a good job of reducing that with the mutt muffs and the noisy fan and through the dog's ear, the music, whichever of those things. There are, if your dog has some obedience skills, you can work with your dog. You're not comforting an anxious dog. What you're doing is saying, look, you're feeling a little bit better. Sit, roll over, play dead, jump through the hula hoop, but whatever fun tricks that you enjoy doing with your dog, and reinforce your dog with food. Again, if the food has been withheld a little bit, then they're a little hungrier and they're going to focus on working for you instead of wigging out, okay? Relaxation exercises can be so valuable. T-Touch, Tellington Touch, you can look it up on the internet. You'll find YouTube videos on it. And rather than just doing these relaxation exercises, I like to wait for the dog to calm itself just a little bit. You pay no real attention. The dog's body posture softens just a tiny bit. Then you reinforce that with a calming, which reduces the dog's anxiety and fear even more. So by requiring the dog to work for the great privilege of the calming exercise like T-Touch, then the dog and you are participating and you're working together. Again, your dog is getting that security from you. It's about the dog earning the interactions, earning the access to the food toy or the relaxation, so that this dog says, okay, good things happen from my leader, and what you're not doing is mistakenly worsening the whole problem. There are behavior modifications, desensitization and counter-conditioning exercises like playing these sounds and increasing the volume very gradually so that the dog learns to become desensitized. These are really time-consuming, frankly, tedious. They can have value. I'm not discounting it altogether, but my point is that it takes a long time. And to hope that those things by themselves will help substantially, they generally are only valuable as an add-on. And they can be valuable for that. There are medications. We have no business being anti-medication. We should do everything we can to help these pets feel better. And there's a whole list of them. And if you're not trained in these things, they're not going to mean much to you. But the one on the lower left is called Sileo, S-I-L-E-O. Your veterinarian probably has that in the pharmacy. Ask for it. It works in just 20 minutes. You can use it during the noisy event. It's a little better prior to. Good for about 2 hours, and you can repeat it as needed. Very, very safe. Goes between the lower lip and the gum. Comes in a syringe, there's no needle, and you deposit a little glob of this stuff between the lower lip and the gum. It absorbs across the mucous membranes in the mouth, across the gum or the lower lip, and it's very, very helpful. And so I would encourage you to contact your veterinarian ASAP and have that on hand for the weekend. So who has questions?